Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we considered the third anxiety disorder, namely the obsessive-compulsive disorder, also known as OCD, in detail. In this episode, we begin our analysis of behavioral disorders by elaborating on attention deficit hyperactivity disorder or ADHD. Behavioral disorders involve a pattern of disruptive and unsettling behaviors that last for at least 6 months and cause problems in school, at home, at work, or in other social situations. Often, behavioral disorders include inattention, hyperactivity, impulsivity, defiant behavior, drug use, or criminal activity. Everyone may show disorderly behaviors at times, such as forgetting to do their homework, daydream during class or work, or become restless at dinner table. However, behavioral disorders are long-lasting, serious, and messy. Attention deficit hyperactivity disorder or ADHD is one of the most common behavioral disorders. It is a neurodevelopmental disorder that typically appears in early childhood, usually before the age of 7. Inattention, impulsivity, and hyperactivity are characteristics of ADHD. Thus, children with ADHD display hyperactivity problems related to inattention and impulsive behavior. It makes it difficult for children to inhibit their spontaneous responses that can involve everything from movement to speech to attentiveness. For instance, finding it difficult to sit still, never seeming to listen, not following instructions, no matter how clearly they are presented, blurting out inappropriate comments at inappropriate occasions, and the like. Often, children with these behavioral patterns can be labeled as troublemakers or criticized for being lazy and undisciplined. However, they may have ADHD. Though ADHD is often thought of as a behavioral disorder in children, persons who have it do not outgrow it as they become adults, because it can continue to persist through their developmental stages. As a neurodevelopmental disorder, ADHD affects 11% of school-aged children, and in 75% of people with ADHD, the symptoms continue to persist in adulthood. There are 3 subtypes of ADHD. First, inattentive type ADHD. People with this type ADHD are inattentive but not hyperactive or impulsive. Second, hyperactive impulsive type ADHD. People with this type of ADHD are hyperactive and impulsive but able to pay attention. And third, combined hyperactive impulsive and inattentive type ADHD. People with this type ADHD are inattentive, hyperactive, and impulsive. This third type is the most common form of ADHD. The first 2 subtypes display their own specific symptoms, while the last subtype manifests the symptoms of the first 2 types combined. Let us briefly consider the symptoms of the first 2 types. Persons with inattentive type ADHD may find it difficult to pay attention, become easily distracted, have difficulty focusing on tasks that calls for longer attention, start a task but bored with the task before it is completed or forget to finish it, appear not to listen to instructions or when spoken to, have difficulty to remember things, to pay attention to details, or make careless mistakes, have trouble to stay organized, to plan ahead, and to finish projects, frequently lose or misplace homework books, toys, and other items, and avoid tasks that require greater mental effort. As a result, though they may enjoy hearing about the topic they are interested in or doing tasks they like, when the task becomes repetitive or boring, they get quickly tuned out. Likewise, they may bounce from task to task without completing any of them or skip necessary steps in the procedures if one or the other step calls for greater mental focus. Similarly, organizing themselves and their work would be harder for them. They usually need calm and quiet environment in order to stay focused. Persons with hyperactive impulsive type ADHD may find it difficult to stay still or remain seated, display restlessness by tapping hands, feet, or moving around in their seat, run around or climb things when it is not appropriate, frequently intrude on or interrupt other people's conversations or games, blurt out answers without waiting to be called, or say wrong things at wrong time, display impatience, be quick-tempered, and have difficulty to wait for their turn, have difficulty to play quietly, to relax, or to participate in quiet activities, talk incessantly, excessively, and loudly, do things without considering the consequences, act without thinking, guess for solutions rather than taking time to find the right solutions, and be unable to keep strong emotions under check, resulting in angry outbursts or temper tantrums. As a result, they tend to be on constant move and try to do several things at a time. They find it difficult to sit still, their foot tapping, their legs shaking, or their fingers drumming. Likewise, they have difficulty with self-control, which can make them interrupt conversations of others, invade into other space, ask irrelevant questions, make tactless observations, and ask overly personal questions in public. Similarly, they can either tend to be unduly moody or express disproportionate emotional overreaction. Hence, other people can perceive them as disrespectful, weird, or needy. If ADHD is not diagnosed, people with this behavioral disorder get labeled as badly behaved without helping them to deal with the consequences of it disorder they suffer from. Without timely diagnosing of the problem and without proper support and treatment, ADHD can affect them academically, socially, and emotionally. Hence, there is the need for timely diagnosis. The treatment consists in medication, therapy, or both. Along with treatment, family members, teachers, and elders of the person suffering from ADHD must handle them with more care and attention and be empathetic towards their needs. Following tips can help. Establishing a daily structure and sticking to it. This would help the affected persons to stay focused and organized by following a daily routine, a simplified schedule, and keeping them busy with healthy activities. Second, setting clear expectations. This would make rules of behavior simple and explain what will happen when they are obeyed or broken, and follow through each time with a reward or a consequence. Third, encouraging exercise and sleep, as physical activity and having sufficient sleep improves concentration, and promote brain growth. Hence, proper exercise and sleep can reduce symptoms of ADHD. Fourth, helping to eat right. Regular healthy meals or snacks and cutting back on junky or sugary food would make a world of difference for persons suffering from ADHD. Fifth, teaching to make good friends. Having good friends would lead to healthy and affectionate social interactions, which over time can drastically reduce the symptoms of ADHD. Following these tips and giving them the personal care and attention would over time help the person suffering from ADHD to deal with their behavioral disorder and integrate them into their environment and get back to their normal life. In the next episode, we will consider the second behavioral disorder, namely opposition defiant disorder or ODD in detail. Thank you for watching this video. Stay blessed until we see you again with another video.